we have to make them understand that this metabolic surgery is not anything to do with weight. It is for diabetes. And we hope that insurance firms can understand this, that if the person who is a customer with them, if they get free of diabetes, the insurance firm would be able to save on so much more of future expense. Because if a person with diabetes is going to get some complications like heart problems, they have heart surgery, if they have kidney failure, they'll end up with dialysis, then go on to transplantation. If they have problems on the side of the liver, they'll have liver failure, need a transplant there. If they have problems with the eyesight, they need injections in the eyes for the retina, which are very expensive. And then the person might actually go blind if it's not under control. So many of these issues would get solved, and hopefully we hope that the insurance firms can understand this and approve insurance for people who are suffering from diabetes, having some complications or worsening of diabetes, and they would actually be in good health and prevent all major future expenses.
Okay, so now if I am a patient coming to the clinic seeking a surgical solution for my uncontrolled diabetes, I have certain anxiety, I have certain questions to ask. One would be, doctor, how long would the operation take? What will my diet restriction be like? Will I have any diet restriction? Will I be able to eat what I couldn't eat before? Like I couldn't eat sugar before, I couldn't eat sugary stuff before.
Yes.
Alcohol.
Yes.
Yeah. I mean, I used to be a social drinker. How much will I be able to continue after the surgery, etc. And what are the main side effects or the common problems that we see after we do a metabolic surgery?
So after surgery, we want people to understand that there are some very simple rules they can live by. They don't have to follow any complicated diet chart or something. Those are guidelines which our nutritionists would give them. But for the first week after surgery, we want them to be on liquids. After which, according to how their body would accept, they can start having soft foods or have normal food after that. And there is a certain amount of time the body would take for settling down after this surgery. It's like a phase of adjustment to a new system that is operating now. Because with the surgery, we are re-establishing or rebooting, like in computer language that they use, a reboot, a reset of their system, so that insulin is there at the right time when they eat food and glucose is increasing. And so there's a reboot of the system which may take some adjustment time. Some people adjust in a week's time, some people need a month, some people need 3 months. So they should not be afraid of anything and should go according to what the body allows them to do. If they need to be on liquids for a longer time, stay on liquids if you're more comfortable with that. So basically we say, don't fight with the body. Listen to the inner guidance. Now about food, we say you can enjoy everything in life later. If you are having, suppose you're at a function or some celebration and there are cakes or chocolates or ice creams, etc. If you are having a high amount of calories which are from carbohydrates like this, then enjoy it but eat a small amount. If the calories are higher from proteins or fats, it is not a problem. So that's a very simple way to deal with this in life. Activity wise, they are advised walking exercise for the first month. After 1 month, they can go back to sports, gym, swimming, anything. A completely active and normal life. I mean, people go skydiving, they climb onto mountains, etc. after all this. And one of the patients we have, who's an Indian who lives in the US, he has run 9 marathons after the surgery till now.
Wow.
In 11 years. So, I mean, that's a great example for people to understand that you can lead a completely normal, active, healthy life.